Thank you very much at magandang araw mga kaibigan. Nagbabalik po ang inyong programang Aksyon Central Luzon Special Edition. Ito po si Sunny Lopez at kami po ngayon ay nasa Sacred Heart Medical Center. At meron po tayong i-focus yung Cancer Institute. At the same time, gusto rin po namin i-congratulate ang medical center nito because they will be celebrating their 3rd year, no? At yung pong Cancer Institute naman ay nakapag-celebrate na sila ng kanilang 2nd year anniversary. So we will now introduce our special guest. Dati na ho natin naging guest ito. For the 2nd time around, we have the medical director of the Sacred Heart Medical Center in the person of Dr. Aurelia Villaraza. Ma'am, thank you again.
And thank you for being here with us today.
And of course, the head of the director po ng Cancer Institute, Dr. Misael Cruz.
Thank you, sir, for inviting me again.
Ang hirap yung invite very hectic po ang kanilang schedule, no? Pero I'd like to go first to Dr. Villaraza, no? Dahil pangatlong taon yun na ho itong no? So nakalampas na kayo sa mga birth pains. No?
Yes. It was a tedious, gradual process na malampasan namin yung mga birth pains that we call it. But through the joint efforts naman ng medical staff, our personnel, nakayanan naman namin yung mga challenges that came along the way.
And I think you're doing very well, no? The hospital kasi kilala na ngayon sa Angeles and Bunggit ng Luzon. In fact, I heard that pero pala outside of Central Luzon na nagpupunta na rin dito, no?
That's true po. We get patients from halos outside, even from Metro Manila, dito nagpupunta for their treatment.
Do you forecast any upgrade in your hospital, ma'am?
Definitely. Right now, we are licensed for 75 beds, but we are already working on the upgrade to 120 beds. So by November, we will be applying already with the Department of Health for increased license bed capacity to 120.
Hindi pa rin kayo magtuturo?
Turo? Going to the... hindi ho muna, hinay-hinay muna tayo. Yes.
Pero, because I hear this even from the practitioners, talagang daw, especially for the Cancer Institute, no? Doc, can you talk about it? Sikat na sikat ang Cancer Institute niya.
Siguro po, nagpapasalamat kami sa number 1 sa admin, kina Dr. Tan, for giving us this opportunity, this facility to offer it to our patients, no? At the same time, I am congratulating them and my staff sa institute for just having the 2nd year anniversary namin last July. So there are a lot of, sabi nga kanina, birth pains. Siguro ngayon it's the growing up pains, no?
Growing up pains.
Hindi pa ho natapos yung mga pains. Parang mas mahirap yung growing up pains kasi since you have offered these services, ngayon kailangan mong i-meet yung demand ng mga pasyente on how you can really take care of this cancer patient on all aspects.
You're the first one to do this in Central Luzon, right?
Yes po. Actually, before, it was spearheaded by Mr. D dun sa D1 But nagkaroon lang ho ng hold at this time. So the first cleanup dito sa Central Luzon is this institution.
So, as per the experiences in the first 2 years, kasi dinadagsa na kayo ng mga pasyente.
Opo. Normally, as years go by, nalalaman nga ng mga pasyente through one of the means is through media like yours.
Tsaka word of mouth.
Nakikita na nga po. I think it's not just because we're the first, but siguro it's being proven sa services na ginagawa namin, how efficient we're doing it, the results na nakikita ng mga ibang pasyente. Siguro yun yung hikayat sa mga ibang patient. Even, tama, word of mouth, minsan walang referral yung pasyente dadating sa'yo. So just to address this, gumagawa ko kami ng strategic plan on how to really address all the needs of these patients. And I think there are future plans in the institute with regards especially sa expansion.
Okay, kasama na sa
growing pains, yes.
Growing pains naman yan. So ano na yung what do you have right now?
Right now, I wouldn't say we're complete or almost complete kasi po part ng vision ng Cancer Institute is to make it complete for all patients kahit anong klaseng cancer pa yun. So right now, we have primarily yung chemoambulatory unit headed by Dr. Manalo. Unfortunately, hindi siya makakadating yata ngayon. That caters for outpatient chemotherapy.
Okay.
And of course, we have the hospital to cater for the inpatient na nagki-chemotherapy. We have a good staff and a good medical staff that handles the chemotherapy. Marami na ho sila. And then we have the linear accelerator, which is under radiation oncology. Yun ho yung sa amin. And we have a number of good staff also to man it. Yun yung sa radiation. The next one is yung sa prostate cancer. We offer it yung LDR, or tinatawag na prostate seed implant. It is again the first in Central Luzon, probably even north of Manila. That's being headed by Dr. Grino. For liver cancer, we have the RFA machine, which being headed by Dr. Bansil and Dr. Policarpio. Yun ho yung mga, alam kasi nila na dito sa Pampanga, medyo mataas din ang incidence ng liver cancer. So, we're looking ways on how we can help them. And one way is yun, yung radiation frequency ablation. Without operating the same sort, parang ganun ho. Parang tinutunaw kasi, parang ganun. And then, for gynecologic cancer, we have good staff also. I think this is being headed, si Dr. Agadi, nagki-clinic siya dito.
Okay.
So kasama ho namin siya. For hematologic problems, even hematologic cancer, being headed by Dr. Julian. Meron ho tayong latest machine, yung apheresis, na you don't have to really take out the blood of the patient or the donor, bumabalik din habang nagdo-donate sila. And I think this is very utilized sa mga dengue patients.
Okay.
But they can be used for cancer patients kasi bumababa yung dugo ng mga cancer patient, kailangan nilang matransfuse. So basically, I hope I did not forget anything. Basically,
may nakalimutan po mo sabihin
kinikater namin lahat. Oo nga. And future directions po, ang dami-dami. We just had our meeting last week. So these are the future directions. Forgot to mention, breast cancer. Breast care unit pala. It's being headed by Dr. Mercado, Jude Mercado.
Yes.
And again, with the turnout of patients, probably because of the results and the machines available, nagpo-project na rin ho na expand namin into a center talaga yung breast cancer, breast care unit. So this is under the Cancer Institute.
Okay, let me ask the Dr. naman. Cancer is supposedly something that is dreaded. We have this cancer institute because a lot of the cancer, yung hinaharap natin ngayon, treatable naman yan, di ba?
Treatable naman yan.
This is the reason why you have the Cancer Institute here.
Right.
Kasi dati, parang surrender ka na pag nasabing may cancer ka, di ba?
Tama po, tama.
Pero may magagawa yung Cancer Institute na walang malaki.
And that is exactly what we want the public to know. May pag-asa pa. Ang importante is yung awareness at saka yung pag may naramdaman ka or may nakapa ka or parang may unusual na nangyayari sa inyo, kumonsulta ka agad para mas maagapan.
Right, something unusual, no?
Right.
Is there a certain age that mas mabilis na dumadaan po sa atin ito? Kasi merong predispositions, di ba?
Yes, opo. Iba-ibang age group po kasi yan. May ibang age group na sa younger age tumutubo, middle age, and then the elderly ones. So, kanya-kanyang predisposition sa iba-ibang cancer. Siguro po, in general, maganda na pag may nakapa silang bukol o may naramdamang unusual, not necessarily pupunta ka sa oncologist, but you can go to your doctor and have your consultation. Kung bukol yan, pwede kayong pumunta sa amin na oncologist at least so ma-investigan na kung ano yan. Part 2 ng program ng Institute is yung sabi nga ni Ma'am, is awareness through screening, and then yung mga lay projects namin like what you mentioned a while ago, yung sa mga may prostate cancer, nagkaroon sila ng prostate screening program. And then breast month, meron ho kaming breast care, breast screening program for to prevent breast cancer.
So talagang dito na sa sentro.
Yes.
Dito na sa sentro, dito sa Cancer Institute,
Yes.
Sacred Heart Medical Center, no? Was this part of the plan when you put up itong medical
Yes,
center?
Definitely. And in fact, that was the very reason why the Department of Health gave our license. Kasi ang focus namin was to be the cancer center north of Manila.
Okay.
Kami pa lang yung may cancer institute. We're not an ordinary general hospital that provides the usual services. Ito yung pinaka-baby namin.
Talaga yung
Specialty namin.
Yung focus nyo.
Yes.
Although,
Yes.
the hospital deals in
Right.
the ordinary,
Yes.
pinupuntahan ng mga pasyente. Di ba?
That's right. Our doctors come from all fields of specialization.
So sabi nyo yung merong growing pains, ang laki yata ng investment dito. Is that a correct statement?
Right, right. Yes.
These are yung alam na po siguro natin mga gamit sa cancer, medyo mabibigat din yung mga halaga ng mga gamit na yan. Kaya hindi sila basta-basta. Fortunately, turnout naman yung services na i-offer nila is sulit naman. So, to invest, it's not a joke to invest in cancer institute or a cancer center. And it's not only once, but it's continuous. Kasi if your treatment is based on technology, nag-iiba yan palagi.
Technology pa naman tayo ngayon, di ba?
Yes,
Technology-based, a lot of it is
Technology-based.
technology-based, right? So what are some of the mga gamit na nandito na? Yung,
As I've mentioned po,
ano pa yung darating na?
primarily is yung linear accelerator natin,
Oh.
which can accommodate actually all types of cancer. And even those small cancers pwede na rin i-treat. Soon, we've talked with the admin, a plan for another machine is coming to give our services at the utmost efficiency. Yun yung goal namin. The other machine na available is yung apheresis nga, which is being used by the hematology people. Yun po yung sa mga nag-blood transfusion, yung mga kailangan ng platelet, kailangan ng red blood cell. The other machine that we have is yung sa prostate seed brachytherapy sa mga may prostate cancer. The other machine, the next machine is sa breast care. Meron silang mammotome unit, I think. Which is hindi ko kailangan i-open up yung breast, kundi pwede nilang alisin doon without really opening the breast. Then we have the RFA machine, yun nga, yung sa mga liver cancer. So lahat po ito bago, at again, nagpapasalamat nga kami sa administration na they're really open to these innovations. Kinukulit nga namin palagi na we don't stop here, we have to continue.
So yun naman, yung nasa pinag-usapan natin kanina, yung word of mouth, kaya dumadami rin yan.
Yeah.
Because those who come to you, the institute,
Opo.
sigurado ako maraming survivors yan, marami kayong natulungan.
And I think they are satisfied with the services.
Wala nang iba dyan, wala nang mangunguna pa dyan, di ba? Pag yung mga pasyente satisfied.
Yes,
True.
yun.
And in fact, whenever a patient comes, tinatanong namin sino po ang nag-refer, yun po kapwa pasyente nila. Oo. Yes.
So you're very proud of this?
Right, I'm very proud of that. Na ang marketing arm namin, yung mga satisfied patients namin. Yes.
Wala nang, sabi ko nga, wala nang mangunguna pa doon, di ba?
It's a positive problem that we have to keep up with.
Yes.
Kailangan kong i-maintain yun para hindi mapahiya yung ospital, hindi mapahiya yung pasyente.
So you're talking of expansion. Are there, meron pa ba lugar dito para mag-expand tayo for the institute?
Well, right now, yung nakikita ninyo sigurong ginagawa sa taas, binubungan na yung roof deck. So, may mga offices, pinagkulang na, yung mga ibang offices ililipat na doon. And then yung aming
Nagpokos na rin
penthouse.
yung traffic, ha?
It's a positive problem. Yung 4th floor po, which we call the penthouse, i-open na rin yan. As soon as licensed by the Department of Health, that's an additional 34 beds.
Okay.
Yes.
So, anong criteria naman para yung Department of Health will come in and then make this, yung pabilisan ng proseso?
Right. Ang
Kasi
importante,
yung kailangan,
yes,
yung pangangailangan, determined na.
Right.
Kailangan talaga ng
Opo.
area natin, di ba?
we only have to prove to the Department of Health that we have a full complement of personnel who will man the hospital. Tapos, lahat ng mga required equipment, additional equipment, and then yung services nyo, lahat po yun, in place naman ho. So, I'm very positive that we will get that upgrade in licensed bed capacity.
Okay, alam ko may pera kayo. Pero yung
Sila.
yung mga yan,
Yes.
pera-pera yung kailangan niya sa equipment, di ba? Pero yung tao, yung mga kailangan mong katulong, Doc,
Yeah.
nandyan ba yung expertise,
Yes,
we
yun,
have to have a special group of people
correct.
to
Opo.
handle this, right?
Tama. Yun ho yung isang blessing din sa mga staff dito sa institute. We're really equipped as to expertise, professionalism,
Yes.
the criteria of each and every staff. We're almost equipped. And
So-
we make it a point na these are grade A.
So they know that they're being recruited to work for a cancer institute, di ba? Alam nila na mas iba rin yung trabaho dyan.
Sir.
At the outset, you tell them of the greater challenges
Yes.
when you are in this institute, right?
Opo, ang parang irony nga doon, nung una, sabihin nila, pati tayo, pag narinig natin yung cancer, parang, naku, very morbid naman yan, anong gagawin natin. But sabi ko nga sa kanila, hindi nyo pa alam ang kagandahan na nagmamanage ng mga cancer patient. Kasi every day is different. Every day is a learning process. Every day is dynamic. Nag-iiba-iba siya. So as the years went on, itong mga staff ko nga, they started to enjoy and appreciate what they're doing. Na hindi pala ganon. Meron kang, a simple smile from a patient is worth almost curing that patient. Ang laki-laking bagay. A simple conversation with them, kahit hindi sila tinitreat, a simple jokes with them, ang laki-laking bagay ho. So that's what they are doing now. Ang ganda na ng patient rapport nila to the point na na-address yung hindi namin na-address medically, which is having someone to talk to.
Ay, importante rin yun eh.
Yes.
Sa
The support
treatment of cancer,
system.
di ba?
Kailangan po.
Hindi sila nagbubusit, napapasaya mo sila.
Yeah. And that's one of the major plan for the cancer support group naman, which is being handled ngayon ni Dr. Batak. And ang isang vision ko ho doon, it will be the largest cancer support group, active cancer support group in Central Luzon. That will cater both the emotional, psychological preparation of cancer patients.
Yes. Sa pamilya dyan. Silang nasa forefront.
Yes, opo. And we will have siguro professional and legal professions in the cancer support group like spiritual, sa mga pare or lay ministers or other religious group para makater yon. And then,
So holistic talaga yung...
yes, linked to that is our future proposal of having alam nito ni Doktor, is yung, hindi ko pa alam yung word sa cancer shop or a cancer center mall. Something like that. Paano yun? It's like yung pasyente po, pagdating niya, parang may walkthrough siya dun sa kung anong in-expect niya, kung anong mangyayari, kung anong nangyayari sa isang pasyenteng may cancer. At the same time, provide them what they really need in terms of medicine, in terms of the prosthesis, kung mga wigs yan kailangan, na nandun na lahat. Parang isa one-stop shop na nandun na lahat. And probably even spa para dun sa mga kailangang mag-relax to. Ano.
So talagang...
So, we're excited.
Pinag-aaralan, pinag-iisipan ha? Itong
Oo nga po,
treatment,
pinag-iisipan kayo habang natutulog.
Not only for the adults, our pediatric
Yes.
oncologists are also working on a unit naman.
Okay.
For the
Para sa mga
pediatric-
batang
yes.
mabibigyan ng chemo.
Yes.
Okay.
Kasi ngayon po, wala pa siya pero I think pagkatapos ng nasa taas, yun yung workout namin. Na parang may playgrounds para sa mga batang nagkikimo.
Okay. We're gonna have a short break, Dr.
Sure.
Doc, no?
Okay.
Pagkatapos po ng break, pagpapatuloy po natin ang ating po discussion, no? We're zeroing on the Cancer Institute po ng Sacred Heart Medical Center. Yung Sacred Heart Medical Center, I'd like to repeat, they're on their third year at yung Cancer Institute po ay nasa second year na po. Nag-anniversary na po sila mga kaibigan at nag-expand pa at patuloy po ang kanilang ginagawa para po mas mapag-igihan ang yung treatment, yung mga procedures na ginagawa nila for the patients and even for the families of the patients kasi tulong-tulong po ang pag-treat po ng cancer mga kaibigan and I think you heard the doctor talk about it. After this, no, pag-usapan din natin kunwari kung sino yung predisposed, kunwari yung mga maninigarilyo, saan ang pwedeng kapuntahan yan, yung mangingino, ganyan. Okay? Babalikan po namin yan mga kaibigan.
Ako si Shirley Baliana. I'm 41 years old. May cervical cancer po ako. Nalaman ko lang po, lately lang po. That was February. Nag 3 months bleeding po ako. Tapos nahihirapan po akong magdumi, magwiwi, tsaka sa paglalakad. Akala ko po menopause lang po, pero hindi po pala. Kaya po yung mga katulad ko, kahit pag may nararamdaman na, sana po magpatingin na po kahit konting ano man nararamdaman para hindi na po lumala, hindi na sasapitin yung nangyari sa akin. Pinasasalamatan ko po si Dr. Cruz. Siya po yung doctor ko sa radiation at saka po sa brachytherapy. Siya po yung mabait na doctor ko. Si Dr. Kayabyab, Dr. Guevara, yung mga tumulong po sa akin. At PCSO po.